When I saw the first question, Ron, you've been a therapist for 30 years. Do you have any clinical evidence of the changes that your clients' patients have made? No, I don't have any clinical evidence. In my estimation, they got better. In my opinion, they got better. Ron, do you have any clinical evidence? No, I don't. Kelly has clinical evidence with every person who has ever walked into his office. I spent most of my life on active duty in the U.S. Marine Corps and got all of my degrees in counseling and psychology. I then, after retirement, got my doctorate in human development. I instantly saw that Kelly was collecting data as a college professor who was interested in research and the head of many master's level thesis committees. I'm also research oriented, and when I saw that, I said, here's a man who is able to prove the good results that he's getting. I really believe in what Kelly has developed over the past 24 years. I have looked at it from top to bottom and agree completely with what he's doing. Encourage him to continue it and hope that someday the world finds out what a great program he's developed.
I have worked in mental health almost 30 years now, beginning while serving in the military with the Air Force. Then after the Air Force, worked in the mental health system for several years, working with regional mental health centers, psychiatric hospitals, until eventually in '96, opened my own practice. That's been my life. My background is in counseling psychology. In the world of mental health, I find it interesting, just personal opinion, that we have a diagnostical and statistical manual that everyone in mental health uses that identifies all the different ways the human brain can be broken. You've got over 500 pages of descriptions as to how a person's mind can be broken, but not one page of describing what it is to be normal. Subconscious restructuring, very simple. And I think that's what frightens some people in the mental health industry, is because it's direct, and I find the way I view it is it's beautifully simple. That's what makes it simply beautiful, because you can teach anyone. Mental health for years has been content to help people cope. They talk about coping mechanisms. Think about your life. Do you want to cope or do you want to live? Subconscious restructuring is saying live. You can measure it. You can track it over time. And as you've often talked about, I invite anyone to scrutinize what I do.
I was an airborne ranger. Yeah, I was an infantry officer in the United States Army. I saw ground combat in 1983 in Grenada during Operation Urgent Fury. Over the course of a 10-year career, I served in numerous other command and training positions around the world. My experience with psychiatry, especially in today's age of managed care, has shown me that treatment for post-traumatic stress disorder is nothing more than medication management. So I've got a real hard time accepting the fact that our warriors have given their heart and soul for this country, and now they're struggling with these invisible wounds, only to be herded into overcrowded VA clinics where they're expected to wait in long lines only to receive a bottle of pills that have yet to be proven as effective therapies. SR has over 20 years of hard data behind its effectiveness. On a personal note, the results my clients have experienced with SR, specifically the combat veterans suffering with PTSD, their results have been both fast and impressive. So consider this an open invitation for anyone to scrutinize the results of this evidence-based discipline.
In any other organization, whether it's in the civilian world, if you constantly fail at your job and you're in charge of IBM or Ford or a big company or whatever, and you're constantly failing and you're losing business and you're not successful, what happens? You get fired. What happens in the military if you're a company commander and you take your company out and your casualties in your company are higher than all the other company commanders? You get relieved of your duties. Why has not psychiatry in the military been relieved of their duties to lead mental health? Because they're constantly failing. Any other organization would fire them.